And we are officially recording. So we will go ahead and get started with today's webinar.
All right. Hello, everyone, and welcome to today's webinar. How are you staying safe? A community conversation about COVID-19. My name is Hugh Pham, and I work with Monsoon Asian Pacific Islanders in Solidarity. I'm going to be one of the moderators today. Our organization assists victims and survivors of domestic violence, sexual assault, and human trafficking from the Asian and Pacific Islander communities in Iowa. We also do community outreach, youth violence prevention, campus work, and I am really excited to be here today.
And my name is Maddie Tate Smith. My pronouns are he, him, his, and I am the communication specialist for the Iowa Coalition Against Sexual Assault. And so while Monsoon provides victim services, we provide support and resources to the victim service programs throughout the state. So there's 24 programs serving all 99 counties. In addition to providing training, certification, and resources to those victim services, we also do a lot of the legislative advocacy up at the Capitol, which currently not so much of that going on since the Capitol has since the legislature has suspended its session. So that's a little bit about what we do. You can also feel free to check out our website as well. It's www.iowacasa.org for more information about who we are.
So Maddie and I work around gender-based violence issues and social justice issues. We obviously are not epidemiologists or from the public health sector. We are not the experts. We are, however, people who interact with very vulnerable populations, people who can be severely impacted by COVID-19. These are victims of domestic violence, people who are encouraged to stay home in places that are not safe to begin with, sexual assault victims who might be further isolated and not have access to resources. And for Monsoon specifically, our work with a lot of immigrants and refugees. This means that there are folks who don't have the English skills to comprehend all of the resources and information that are kind of being pumped out currently. And even for myself as a native English speaker, there's so much information that it can be really confusing, and sometimes information that is in conflict with each other even. So thankfully, that's why we have Nola here, who has the expertise on COVID-19 and the situation in Polk County. I'm so excited to have Nola Aigner Davis. She is a public information officer and health educator for the Polk County Health Department.
So before we start, I have just a few housekeeping items to cover. First of all, we are recording today's webinar, and the recording for that will be available probably tomorrow once we can get it uploaded to YouTube. So we had almost 100 people registered for today's webinar, so we're really excited about that. We have turned off screen sharing to avoid potential technical problems. It sounds like we had some technical problems regardless, so apologies about that. If you have a question for our speaker or a question for any of us, you can feel free to type it in the chat box, or there is a function where you can raise your hand and we can unmute you. Also, if you put a question in the chat box, we can go ahead and address a lot of those questions in the Q&A portion. Basically, the first 45 minutes here, we're going to be doing a Q&A style with Nola, and then with the remaining 15 minutes, we're going to be talking or answering any questions that you all have. So that's kind of the gist of how this afternoon's gonna go.
Okay. So Nola, I've only met you once, but thank you so much. I just see your name on the screen right now. And from how we've communicated until this day, I know you are very busy. So Nola, I feel like as if the situation, at least in Polk County, started like a slow moving bus, right? And now with the state enforcing more preventative measures, shutting down dine-in restaurants, gyms, bars, along with more urgent messaging at the federal level, the bus seems like it's speeding up, right? Can you provide some insight about what public health officials believe will happen in Polk County and the preparedness of local government and medical systems?
So that is a great question. With diseases and viruses and pandemics, everything changes hourly, even minutes. So we're seeing things change every day, every second of the day. Right now, what we do know in Polk County is there's community spread. What community spreads means is there are individuals who have gotten infected with COVID-19. They tested positive for COVID-19. They do not know how they got COVID-19. So they did not come in contact with someone, or they did not travel to an infected country. Now, what we are seeing is every day we're diagnosing more people with COVID-19. So we do see that it will spread in our community. Right now, I can tell you I'm at emergency management, which is just next door to the health department. We share a building. We have staff here from all the medical communities in Polk County. We have law enforcement, we have EMS, we have people in private and in public sectors all working together to figure out the best way that we can respond to this. So a lot of us are working all the time because we really want to ensure that our community is safe and we're providing them up-to-date information right now.
Okay. Then I think this kind of leads me on to my next question. We've also heard about lawmakers giving Governor Reynolds a lot more freedom to transfer funds from the Economic Emergency Fund. I think it's $20 million between agencies in response to COVID-19. What does that really mean in terms of relief for folks affected by this, especially for those who are those vulnerable populations, low income, the elderly, those facing mobility issues, immigrants, refugees? Do you have any information about that?
I do not have any really information about that. That is something that I'm not privy to a lot of information about. When that means relief, that means there's allocated more money, but again, we don't know how it will be allocated. So things may be different. It's just hard to know how it will be allocated. But the nice thing is that it can provide emergency management and public health more financial stability, so we can really help the vulnerable populations that we need to serve as of now.
And Nola, do we know about how many people have been infected with COVID-19 in Iowa, and what that looks like statewide?
Yep. So as of yesterday, we have seen 38 individuals in Iowa that have tested positive for COVID-19. We have 3 in Polk County. The majority of our cases are coming from Johnson County, and these were individuals that traveled together on a trip. So that is where a majority of that is coming from. But those other additional cases, we've seen some of those cases that were a part of that cruise, and then we see some of them are through community spread.
Right.
Perhaps we can go back to community spread a little bit. When we have something like community spread, which to me is a very frightening idea, what are some of the precautions right now at the Polk County Health and Iowa Department of Health recommending?
I think the biggest recommendation I can make to everyone is if you are an elderly individual, if you are an individual who has an underlying health condition. What do I mean by underlying health condition? An individual has respiratory issues, diabetes, liver issues, maybe they have cancer, a pregnant woman, heart issues. All of those health issues that could tax your immune system, you do not need to be going out in public. If you need groceries, have a family member get you groceries. Now, if they drop those groceries off on your porch and go away, and you can't get them by picking up that bag of groceries, you cannot get COVID-19 by picking up that. Another thing that I would really stress is we need to make sure we're washing our hands. I know that seems common sense, but that's how we get germs. Think about this. This is a respiratory disease. So when I am 6 feet away, so if I cough, talk, and sneeze, and those droplets get in the eyes, nose, and mouth of someone else, I can get that. And then if I touch something, after I touch my hands, nose, and mouth, I touch that table, I can get that. So washing our hands is so important. Covering our cough or sneeze with a tissue or your elbow. Disinfecting surfaces frequently. These are all things that we just need to do daily to try to prevent the spread of this. And I guess the biggest thing is if you're sick, do not go out in the community. If someone else is sick, avoid them. All of those common sense germ protocols that we teach people to do, we need to follow because we know in public health, that's what works.
Okay. You know, I'm glad that you broke it down very specifically, like if someone dropped groceries off and if you picked up those groceries, you couldn't get it. We are hearing folks in the community, I hear stories and anecdotes from the API community about what can prevent COVID-19, what can alleviate symptoms. And I guess I wanted to address some of the things that we know, even I know, not even being an expert, that is just categorically untrue. Some of the things that we've heard is garlic. So we have heard folks roasting whole garlics in their, whole garlic in their house as a preventative measure. Herbal remedies, such as, I think like honey is one of them. There are things that are in our emails when we check them every day. Drinking from a copper tin is something that even just this morning I read about. I've heard that ibuprofen was not recommended, but later on sources like other on our listservs have said, well, maybe they aren't as bad. Can you address some of these? Those are definitely preventative and those are definitely myths.
So we know that the garlic is a myth. I've heard that, so that's a myth. Another one of the myths is that it will die in cold weather, in warm weather. So once it starts warming up, it will die. That is definitely a myth. What we look at is body temperature, okay? This COVID-19 virus likes your body, okay? It likes warm temperatures. So as long as our body temperature stays in that range of 98.6, we're gonna see COVID-19. Rumors that there's a vaccine for it. No, there's not a vaccine for it. To make a vaccine for this, it is going to take quite a bit of time. What else are some of the rumors that we've heard? Yeah.
Sorry, Nola. Do you know about how much time it takes to create a vaccine for something like this? Because I think that kind of plays into sort of what Hugh's been saying. It's like people are like, oh, it's going to be just a matter of time before they have a vaccine. How long does it take for something like that?
So think about the flu. And this is a good analogy of how long it takes to make a vaccine. So every flu season, so think about the vaccine that they're making for 2000 and 2001 flu season. They have started making that vaccine already in January. So January of 2000. So if you think about it, it may take 6 months to a year to get a new to create a vaccine. So vaccine doesn't happen overnight. It takes a while to make.
Right.
We've heard that ibuprofen and Tylenol, there's still different evidence about it. We've heard Tylenol is better than ibuprofen if you do get a fever for this. So again, but this is such a new virus and we're learning new things about this virus every single day.
Okay. Well, 6 months to a year, huh?
Yeah, it takes a while to make vaccines.
Yeah.
Right.
So, I wanted to, as far as we're talking about some of the precautions, I know the term social distancing has really been trending lately on the internet, and just kind of, you know, who would have thought that social distancing was a term that a lot of people would be familiar with at this point. And you know, one of the things that I've been talking about with other victim service providers and even coalitions who work with victim service programs is this concept of social distancing can seem fairly isolating, and how especially for survivors of sexual abuse or domestic violence, how the phrase social distancing can just make them feel very alone. And so I know that some of the language that other victim service programs have been using has been physical distancing, but social connectedness, right? Like being able to connect with folks, like either through FaceTime. I know my parents are older, so we have our son FaceTime with his grandparents like every night pretty much, you know, stuff like that. So what else can you tell us about this physical distancing, and why is it so effective, and other suggestions that you have as far as that's concerned?
So think about exactly what we talked about with the disease. We know that it can spread, COVID-19 can spread about 6 feet away from each other, okay? So if I cough, talk, or sneeze, and I'm about 6 feet away from you, and those droplets from my mouth or nose get into your mouth or nose or your eyes, you can become positive with COVID-19. So that is why it's so important that we kind of keep that social distance. When we're away from each other, that helps us to not spread germs. But by all means, that does not mean you isolate yourself. This is a time where we can come together as a community. Think about FaceTime, think about Skype, write letters, text, call. These are all such a, Zoom, exactly like we're doing right now. These are all such important things for us because, again, think about this, and this is what I think about. When we are at such a period of uncertainty with this illness, it causes anxiety in a lot of us because it's fearful. So we need each other. We need to rely on each other to be able to have that conversation with each other. Talk to your friends, talk to your loved ones, talk to your family. Just because you can't see them doesn't mean you can't be in communication with them. Because if we talk about this, and we express things that are bothering us when we can't physically see someone, this will really help to reduce some of that uncertainty about this disease.
And Nola, do you think that the message has become effective in the community, explaining what social distancing is and why that's helpful? I know that sometimes that idea can also be very difficult for certain communities. I can think of lots of API communities where their families, there's a lot of people in one household. How do you socially distance yourself if your household is a fairly sizable one? What are suggestions on how to deal that in that familial way?
And I think that's a very good question. I think we're just in some situations, if we have a large household, it's hard for us to social distance ourselves. It's hard for us to be away from each other. So I think this is when we talk about disinfecting frequently touched surfaces, this is so important. So think about the remote, think about the doorknobs, think about light switches, things that people touch often. We want to make sure we're disinfecting them. And if you're in a situation where a person may be sick and you cannot, be away from them because just how your living situation is, think about maybe isolating a person in a room. So make sure maybe someone who is sick or exhibiting symptoms stays in a room away from everybody else.
And how long should they stay in that room?
So right now we know that the incubation period of this disease, people can start showing symptoms anywhere between 2 to 14 days. So right now we're really encouraging about 14 days.
And if someone is showing symptoms and let's say is part of a larger family dynamic, like I'm trying to think how to phrase this. Like, how do you make sure that that person is still part of the family and not completely out on their own, right? Like, do you know of of any like how do we do that, right? Because you don't just want to put someone in a room and be like, see you later, right?
No, and I totally get that, because that creates that isolation and that may create anxiety and fear. But we want to make sure the person who is taking care of them is taking precautions. So that person, you know, make sure that they are being at least 6 feet away from that person. If they go in that room to maybe change out a garbage can, bring them food, they are washing their hands. They are not spreading the germs of the infected person to somebody else. So there are definitely ways around this. We just really want to stress that germ hygiene is so incredibly important.
Well, so the scenario, if someone does feel sick now, people have allergies around this time as well. People are asthmatic, right?
Right.
At what level of precaution would you recommend? Should they be distancing themselves, you know, with allergies that they kind of expect to have around this time?
So
What
that,
are things that is like a sort of a checklist where they should make a call to their primary care?
so that's a really good question. And let me pull up that information for you. I don't have everything memorized right now. I pretty much, but
No, I thought you would.
Hold on one second.
Yeah.
No problem.
No, I've just been around a lot of social situations, and I think others probably have, where you know, someone has like coughed a little bit or sneezed, and that person says, "I'm so sorry, it's just it's just allergies.
Yeah.
I swear I don't have COVID-19."
Right.
But
So,
then, but at the same time,
yeah. So right now, individuals, patients who are confirmed positive with COVID-19, they may have mild to severe respiratory symptoms, illness. The symptoms might be a fever, a cough, a shortness of breath. Some individuals may have muscle aches, headaches, sore throat, or diarrhea. Again, these symptoms experience 2 to 14 days. So this is the guidance that we provide everyone. If you have symptoms of a respiratory disease, you should stay home at least for 7 days, and 3 days with no fever or improvement of respiratory symptoms, which is longer. You should have your fever should be gone for 3 days without using fever reducing medication. So for example, if you have a fever and a cough for 4 days, you need to stay home 3 more days with no fever for a total of 7 days. We want to make sure that person goes 72 hours without a fever and without using medication. Now, let's think about this. If you have symptoms and you can manage those symptoms at home, 80% of the individuals who test positive for COVID-19 are going to be able to manage their symptoms just fine at home. Okay, that's 70 to 80% are going to be fine. Okay, you don't need to seek healthcare or you need to be tested for COVID-19. You can stay home while you're sick. But if you are an older adult or an individual has a medical condition, it would be helpful to let your healthcare provider know. So one of the things that we have and we've created is the 211 medical line. And the 211 medical line is a partnership with United Way 211. This line is open Monday through Friday from 8 a.m. to 5 p.m. We have trained medical staff answering health questions. This is kind of that triage line that if you think you have tested positive for COVID-19, a nurse will walk you through this and talk to you about your symptoms. They're going to assess you over the phone. Then if they think that you have a symptom, they're going to tell you to call your primary healthcare provider. Your primary healthcare provider will again assess your symptoms. They're going to make sure that you test negative for a flu test first, because we know flu is still widespread in Iowa. And then if they think you test positive, they're going to test you for COVID-19. Okay. So that's kind of a little long and short about it.
Okay. So I guess, you know, one of the things I've been hearing about more, which concerns me, are the folks who tested positive for COVID-19 who really felt like they displayed no symptoms, and that those folks, you know, obviously wouldn't feel the need to call 211 or call their doctor, right? So I guess that's what you mean by community spread. But for like a sniffle, for a sense of a cold that you can basically manage any other time, would your recommendation, it seems like, not necessarily be to rush to the doctor's office or necessarily even call 211, but to stay home,
Yep.
see how it goes. If it gets worse, call 211.
Yep.
And then,
I think the biggest thing is if you are in respiratory distress, this is when you need to call your healthcare provider. When you start feeling like you cannot breathe and you have difficulty breathing, that is a scary thought, and you need to reach out to your healthcare provider.
okay. But if you just have a fever.
Yep. And if your fever is under 100.4, then that's a low grade fever. But if you've had a fever for a while, then that's a time to call your healthcare provider.
Okay. And then your healthcare provider is the one who provides that test, the COVID-19 test?
Yes.
Where is the test done?
So the test would be done at your doctor's office. It's just a swab that they stick up your nose like a giant Q-tip, and then they send it out to a lab for the lab to test it.
How soon would you know the results?
Right now we're saying 24 to 48 hours, but that may be a little longer because it may be taking a little bit longer to test.
And I don't know what the situation is in the county, but is there a concern that there's not enough tests for the amount of people who might want to be or need to be tested?
Yeah, and I think that is not only a concern in the community, but that's a concern nationally and internationally. This is such a new virus, and we had to create tests specifically for this. So we're trying really hard to make sure that we have laboratories on board that are able to test.
Okay.
Cool.
Mm-hmm.
Nola, so we received a really good question actually in the chat box. Vanessa and others want to know, I have a question about takeout or delivery food. Is it really safe, and what are the best ways to go about this?
Yeah, that's a good question. I mean, think about it. Each restaurant, food establishment has certain protocols that they have to follow. They get inspected by inspections of employees and appeals, Department of Inspections and Appeals. And think about this, if someone is sick, I would hope that their supervisor would not want them to come in and make their food. But, think about it too. You could have, let's say you test positive for COVID-19, you don't know where it came from. It very well likely did not come from the place you ate at. So again, with community spread, we have no idea. But a lot of restaurants are going through critical, really taking this seriously because they want to make sure they provide excellent service for their staff and their patrons, excuse me.
But would you say, generally speaking, then it's safe to do takeout or delivery, or is it just kind of, because I do feel like there have been some mixed messages about that, right? But I do know also I'm seeing a lot of information from restaurants on like social media being like, this is what we're doing.
And I think that's because, think about the restaurant industry. That's their business. And we close restaurants, that's hard. So a lot of restaurants are taking extra precautions to keep you healthy, but to also feed their employees. And, I work in this field every day and I've still gotten takeout. So it never changes my outlook. And I work in this field. So if that gives people an ease of mind.
That's helpful.
Since we're talking about food, I think this is kind of going to sort of refer back to what we talked about in terms of myths, and actually kind of like connect to something else I wanted to bring up.
Mm-hmm.
One of the things that we've also heard as a myth is that as a precaution, folks should not order things that are from China, right? Like folks should not be ordering from Chinese restaurants.
That is such a horrible myth that people are placing.
Yeah.
Just because you are from China, just because you are of an Asian descent, does not mean that you have anything to do with COVID-19.
Right.
Just because
I think for some people, this it doesn't help that we have heard of it referred to as the Chinese virus, not just like on one occasion, but on multiple occasions. And so I think that we are starting to see in the API communities, even here, stories like anecdotes of of racism, microaggressions. And, you know, that is something where if we are going to be in the long haul with this, and it seems like that's the case, does the state have any ideas, any plans to address the xenophobia, the targeting of API communities? Because it's happening on every sort of level where people who, you know, I have interns, you know, Asian American interns who say, I'm afraid to cough because I don't know when people look at me, whether or not they think that I have COVID-19. Or my own mother going to an appointment at a clinic, people avoiding her in the elevators and she's the only one there. You know, things on this playground before schools were shut down, where obviously youngsters are, you know, kind of repeating probably what they hear at home about what it means to play with their Asian schoolmates. So yes, is there any, in terms of public information and disseminating that out, are there any plans at all to address this part?
I know that Iowa Department of Public Health, I know the Centers for Disease Control and Prevention have put out messaging in regards to this. And you know, you can put out messaging all you want, but it's really hard to change people's points of view when they already have negative tendencies, negative beliefs towards other cultures. It's really hard for us to get around that. And, you know, I thank IDPH and I thank the CDC for putting out those messages, but I think we all as a community, you know, this is why social media is amazing. You need to be spreading those messages with everyone on your social media pages to really enforce that message. It's really hard to hear that, and it's really heartbreaking to hear that people have had to experience that. You know, diseases can come from anywhere, and I think it's just so very unfortunate.
Well, I think at Monsoon, that's one of the things that we want to make sure to really, you know, be in conversation with people like yourself, to make sure that we're in conversation with the community, so that we can really challenge some of these beliefs, and then we'll continue to try to represent in sort of correct the score, I guess, right? But yeah, we are trying to be very observant about what's going on locally anyway, what we hear. And so folks can look forward to us having other virtual conversations. We're going to attempt other things, and we're going to talk to specific API communities to see how they're experiencing this. What does it mean for them to socially distance? How have people been treating them? What has their experience been as this pandemic increases?
So just start with that and then open the questions.
Sure, yeah. So at this point, we want to talk about some community responses. You know, I wanted to take a moment to say like one thing that has been really heartening about all of this is the amount of community members and groups who have stepped up and tried to assist in some way with providing information or goods or services. You know, we've heard of folks that are volunteering to do errands, especially for elders. Either, you know, they're running to pick up something from the grocery store and then dropping it off the front door, that kind of thing. That has been really heartening to hear. We've seen other things like companies offering free Wi-Fi or reduced Wi-Fi, local restaurants, you know, donating food. There's been a slew of grocery stores and other like sort of national chains even who have reduced or not reduced their hours, but have limited designated certain hours for people who are much more susceptible, or you know, like senior citizens, you know, expected mothers. Yeah, you know, an hour before they officially open to the rest of the public, where those people are encouraged to come so they can shop a lot more safely than normal. So I have, we've compiled a list of those resources, and this is what I would just call a working list, because that list continues to just to grow, even as I had printed something out here to share and be available to people who are participants in this webinar. I was just getting more emails with other resources, but we're really, really trying to just have this like sort of list put together in just one document for folks. But Nola, are there resources, community aid that you can make us more aware of? Some of the ones that I know are, exactly just from the county's website, some from, like organizations that we're more familiar with, especially those who assist immigrant populations. But is there sites, links, other things that are new and upcoming at the county level that you can share with us?
Everything is changing by the moment. I think the best thing that you can look at is the Polk County Health Department website. We try to keep up to date on all of those resources for individuals. Every organization and community is doing things a little bit differently, again, because things are changing so much. But I really encourage people to look at our website. That's where you're going to get the best information.
Okay.
And is it also fair to say that the Iowa Department of Public Health website is
Absolutely.
a good place for
Yep,
folks
it's a
to get info?
great. And you want to look at national, look at the CDC.
Okay.
For folks that are struggling already now, do you know if, so a lot of our clients, for example, will use the county's general assistance for rental assistance, utilities, sometimes even food. And do you know if there's is the criteria lessened at all that it would accept more folks than normal? Has funding for that?
That I have not heard a lot about, but if we do hear things, please visit our website, because then we'll include a lot of that on our website.
Okay. Then I think, did you want to add anything, Nola? Otherwise, we're going to we're just going to start the questions and ask the participants if they have any.
Okay. That would be great. Whatever questions I have, I'm sorry, I'm going to answer what we've got, and I'm going to get pulled into another meeting. So I'm sorry that my time will be cut a little short. This is just pretty crazy right now.
No, we understand.
So what can I answer?
So some of the questions, so someone had asked regarding food, like what do you do about the packaging? And then someone else had answered, Hannah, I've taken food out of packaging, thrown packaging away, and washed hands again before eating.
I think that's a fabulous strategy. Absolutely. You have no idea who touched that. So think of a box of spaghetti that you picked up at the grocery store. We don't know who touched that box of spaghetti. So wash your hands, put the spaghetti in the pot, wash your hands again before you're making the food. Again, we really encourage, when you're cooking, before and after or during, always washing your hands, because again, that also avoids cross-contamination.
Okay. And then Lisa says, I'm at high risk because of immune suppressive drugs. All my staff are working from home. Is it safe for me to come into the office?
That's a good thought. I would say right now, if you're going into the office to pick something up and there is no one there, then you should be okay. But right now, if you're immune compromised, you should not be going places that you shouldn't be. So I really suggest staying at home, working at home, have a loved one, have a significant other, helping get medicine for you, get your medicine, get your groceries, anything you need. Your health is so very important during this time.
Okay. And again, as a reminder, as we're asking and answering these questions, feel free to put anything else into the chat box that you might have for questions. We do have one from Lizzie. What do you recommend for individuals who may not be set up with a primary care provider if they are experiencing symptoms and are encouraged to contact their medical provider, but they do not have a primary care provider? What do you recommend?
I encourage them to call 211, the medical line. That 211 medical line will help assess if they need to see someone. And then the best thing that we can say is call someone who is seeing patients. You know, it's hard for us to refer to someone that we can help, but if you call 211, that medical line, they can help triage you to see if you really need symptoms, if you really meet the criteria. And then from there, maybe from there we can help you find a healthcare provider. So then again, I would just suggest looking at healthcare providers that are accepting patients. And it's hard right now too, because we know a lot of the free clinics are closing, and a lot of that is really crucial to a lot of populations. So primary healthcare said if you are an individual that you need healthcare, to reach out to primary healthcare.
Okay. We have another question from, I think it's Halu. Is
Okay.
there interpretation available on the 211 line?
Yes, there is. They have a language line available on the 211 line.
Oh.
Are those for multiple languages then?
Yes. Yep, they have multiple languages on 211.
And then Vanessa has a couple of questions here. So should we be, I've thought of this one myself, should we be wearing gloves? Should we be wearing masks at the grocery store, or is washing our hands sufficient?
So we encourage you not to wear masks. The biggest thing is to, if you have masks and you can do this, please donate them back if they have not been used. The governor released an email yesterday, released a press release that's saying if you have like PPE such as gloves and masks, and they have not been opened, please return them or please donate them to a healthcare service. There are so many healthcare providers right now, hospitals and clinics, that have such a shortage. We really need to think about keeping those gloves and masks for those people who need to take care of the very vulnerable. So the best thing I can say is do not go to a grocery store with a mask or gloves. Just wash your hands.
Okay.
Also from Vanessa, who in the state can I reach out to in order to assist with Spanish translation for written materials?
Yeah, Vanessa, if you want to email me, my email address is Nola, N-O-L-A, period. Here, I'll write it out. Here's my email address. And you can email me, and I can get you in contact with the state communication office, because that would be great if you could help translate information for them, because we need that.
Mm-hmm. We also know that I think it's the Refugee Alliance of Central Iowa has COVID-19 information and resources in lots of different languages.
Yeah, they have they have
so
a great tool on their website for a lot of different resources from a lot of different sources. So please use that. I've helped provide some resources for that site, and I know they're updating it. I know Stephanie at Rossi's been doing a ton of stuff right there.
Yeah, and that's going to be included in the list that we have and that we'll share to the group.
Awesome.
It looks like Valerie says, I use hand sanitizer while picking up items at the grocery store, and I use disinfectant wipes on my counter and anything that I touch. I know that there's a shortage recently of hand sanitizer and disinfectant wipes, but I presume, Nola, that that's still an effective way to clean surfaces.
All of those are such great surfaces. So hand sanitizer, disinfecting wipes, all of those traditional methods that we use to keep ourselves healthy, keep using those.
We have a follow-up question to the 211 interpretation question. Basically, do you just dial 211 and hit send? Will it then prompt you to if you need an interpreter?
Yep, so call 211. Someone will put you on the line, and you'll say interpreter, and you'll say what language, and they'll hook you up with language line. The biggest thing I really encourage people to know, though, is it is a wait line. I mean, think about everyone has questions, so please be patient with 211. They are trying to answer your call in a timely manner.
Great. Valerie has a question here, and actually this is a good question, and made me think about one of the conversations Hugh and I were having where people are trying to make their own sanitizer using vodka. Now, that is not Valerie's question, but
yeah.
Valerie wants to know, can I use bleach and some water solution to clean with? And I guess my question would be, what other home remedy solutions might be available for folks who just aren't able to find the hand sanitizer and the disinfectant wipes?
So if you visit our website, polkcountyiowa.gov, there is a link that provides the most up-to-date list by the CDC of EPA-approved cleaners to help kill COVID-19 in your house. So look at that list. They have a ton of resources to help you, keep your house and your office clean.
What was that website again?
So go to polkcountyiowa.gov, and there's a list of the CDC cleaners on there, and that will help.
Along these lines, I've also, I know it's also a myth that drinking a lot of water will fight COVID-19.
Drinking a lot of water is great no matter what, because when you stay hydrated, that keeps you healthy.
Right, but I've heard that folks are
you can't drink 2 gallons of water and to expect not to get COVID-19.
Yeah, two of the ones that Maddie just held up. Right.
Yeah. No, I mean, I drink water every single day, but everybody drinks water. Again, water is great to help keep you healthy, but it's not going to do anything.
Okay.
Yes, and 211 can give you an option to get a call back. That's very true. You can put, and you get a call back, and you'll stay in the queue of the way your call was received.
That's super helpful. So you don't have to stay on hold for like an hour.
No, you can do that. Yep.
Okay, great.
All right. Do you know if more interpreters are also available for clinics and hospitals? So say, for example, someone who has a primary care provider is just feeling ill and calls their doctor first, and they need an interpreter. Do you have any insight about that?
I don't have any insight about that. Every healthcare system is a little different on what they do for interpretation. So I would just expect the normal processes that happens when you call your healthcare provider.
Okay, which I think is going to be a challenge because before all of this happened, what was going on is that a lot of our hospitals were cutting back their budgets for in-person interpretation and using language line. And so one of the things is, even if there is language line for 211, conveying that information over the phone is going to be difficult.
I know.
So that's just
it's just really unfortunate right now. So I want everyone to realize that we're all in this together, and that if we remain safe and healthy, we can get through this together. We've gone through a lot of things together as a city, as a state, as a nation.
This is a really good question from Hannah. If someone has limited phone access, are they, so i.e. an emergency phone, are they still able to call 211?
They should, but I don't know how that works. I'm not 100% sure how that works.
Okay. So, Haley, we can email you directly the link to the list of cleaners.
Unless, Nola, is there a way to?
I am looking right now on my website. I have my tablet open while I'm talking to you, and I can't remember where I put that link. But I know it's somewhere.
So for anybody not in the chat box, we're trying to find a link for the cleaners that the CDC says will kill the COVID-19 virus in your home. So hopefully we'll be able to find that and put that in the chat box. We're also planning on sending out, I believe Hugh mentioned the local resources as well after today's webinar.
Yeah, so those who participated, we'll send that out, and I will update it a little bit to include things like the list of approved cleaners. And again, it's going to be a working list, but it's a pretty comprehensive one as of now. Okay,
are there any other questions that folks have while we are trying to find that link?
I will email Hugh and Maddie that link, and then we can send it out.
Sounds great. Thank you.
Thank you, Nola.
So we want to be respectful of everyone's time. Are there any other questions that folks have while Nola is still available? Oh, we do have another question.
Okay.
We have worked with folks who are experiencing symptoms but did not meet the testing criteria when they spoke with their healthcare providers. They were told once mobile testing sites were up, they would get a call back. Is there any, great question, is there any expected date when the mobile testing sites will be up and running?
I know that, so go back for a second. If that person wants to go, Haley, if you go under to our general COVID-19 situation update page on our website, and you look down to cleaning and disinfectants, there's a link that's by americanchemistry.com, and it tells you all the novel coronavirus fighting products.
Cool.
Okay. We don't know right now. You know, our health systems right now are literally meeting every single day together and working on this. This is such an ongoing process that hopefully soon we'll have something up and running.
But you don't have a time frame just yet?
I can't tell you a time frame off the top of my head right now.
Okay.
It's such a fluid situation that things are changing every single day. So hopefully sooner rather than later. I know that the Iowa Clinic has drive-through testing available.
That's the clinic in Iowa City, correct?
Nope. The Iowa Clinic is in West Des Moines on 60th
Oh,
Street.
I'm sorry.
Yep.
West Des Moines. Interesting. Okay.
Okay. Well, I think.
Any last minute
Yep.
questions that we can answer super quick? Okay.
All right. Well, thank you. Thank you everyone for joining us. And thank you for those who asked questions. Thank you, Nola, for answering the questions as best you could. Thank you for being present. Everyone, please keep your spirits up in this time.
Mm-hmm.
Like Maddie said, it doesn't have to be social distancing. It could be, what was the another term?
Physical distancing, but social connectedness.
I like that.
I didn't coin it myself, but I've been embracing it.
Absolutely. So thank you everyone so much. Again, please visit Polk County Health Department website and our social media and for the most up-to-date information on COVID-19.
Thank you, Nola.
Thank you, everyone.
Thank you, everyone. Have a good day.
Take care of yourselves.